Good afternoon, everyone, and welcome to the COVID-19 update for Monday, December the 7th. Today marks the 18th day since our toughest statewide mitigations of the fall, Tier 3, took effect. And I'm hopeful that some of the recent early improvement in our trends will continue. But to be clear, the numbers still have a long way to go to move away from what could reasonably be called the danger zone. In other words, the surge on top of a surge that national experts have said might define the holiday season is still the focus of our attention. Statewide, approximately 3 in 4 of our staffed hospital beds are currently in use. That's not the kind of statistic anyone should hang their hat on while infections are rising nationally and states around us are running out of room in their hospitals. That's why it's more important than ever to stay masked and stay home. And let's remember that a surge in community transmission is a certain prelude to more lives lost. We're seeing it throughout the Midwest and the nation. Illinois is now averaging 152 deaths per day from COVID-19. That's an average 35 more individuals per day than the worst rate that we reached back in the spring. Each of these individuals, and over the last 24 hours, we lost 90 of them, survived for months during this pandemic. Some of them might have gotten tired and let their guard down. Others might have been trying their best to do all the right things and somehow, some way, still got infected in this horrible pandemic that's still ravaging our nation and taking more than 1,000 American lives in the last 24 hours. But even without knowing each of their pandemic stories, I can tell you this: most of those deaths were preventable if everyone would wear their masks. I can tell you they leave behind countless loved ones who are grieving lives stolen too soon. And I must ask you to please do everything in your power to save your loved ones from that same tragic loss. Focusing specifically on the state of Illinois, our case and test positivity average rates have remained around 10 and 12% respectively over the past week. This is a key indicator to let us know if we'll see a spike related to Thanksgiving. Statewide, we've seen a slight decline in people getting tested and in turn a slight decline in our positive cases, likely a result of an uptick of people seeking to get tested before Thanksgiving. So far, we haven't seen our positivity rate start to creep back up, which is a good sign. But we also haven't seen it substantially fall. Not a good sign. It may be that our mitigations are working to offset the expected surge in cases, but we won't know that for sure for at least 2 more weeks. As you know, COVID hospitalizations lag cases reported. In the most recent week, we've started to see a slight decrease in hospitalizations. And even with this downward movement, our COVID-19 hospitalization total statewide is still 14% higher than our spring peak. If you're wondering why that particular figure is important, if we're starting to see a downward trend, it's this. 14% higher than the spring means that our hospital's ability to handle another surge is tighter than it was last spring. It's likely too early for us to have yet seen the bulk of Thanksgiving-related hospitalizations yet. We're now in our 11th day since Thanksgiving, and we are 4 days out from Hanukkah and 18 days from Christmas, 19 days from Kwanzaa, 24 from New Year's Eve. These next 4 weeks may be the most crucial month of this entire pandemic. We quite literally have very limited leeway in our hospital systems to manage another surge. So mask up, keep your distance, and plan smaller, more intimate holidays this year. Let's give each other the greatest gift of all this holiday season, good health, and a bright future. Thank you, and now I'd like to introduce Dr. Ngozi Ezike from our Department of Public Health.
Good afternoon and happy Monday. As you have heard, the U.S. has entered a new phase of high-level COVID-19 transmission. Today in the state of Illinois, we are reporting 7,598 new diagnosed cases of COVID-19 for a total of 787,573 cases in Illinois. Sadly, news of an additional 90 deaths were received for a total of 13,343 lives lost here in Illinois. And of those deaths are included a teenager, an individual in their 20s, an individual in their 30s, as well as those in their 40s and 50s, as well as 60s and older. This is just another reminder that COVID doesn't just sicken and kill older adults, but can be a deadly disease at all ages. Overnight, 5,190 people were reported to be in the hospital with COVID-19, and of those, 1,123 were in the intensive care unit. 648 patients were on ventilators. In the last 24 hours, more than 77,500 tests were reported for a total of over 11.1 million tests in Illinois. But as we spend more time indoors because of the colder temperatures and as the holiday season continues, it's essential that we implement all of our public health strategies at both the community level and the individual level. And these critical evidence-based CDC recommendations and sustainable strategies to reduce COVID-19 transmission include universal face mask use, maintaining physical distance from others, and limiting in-person contacts, avoiding non-essential indoor spaces and crowded outdoor spaces, increasing testing to rapidly identify and isolate people who test positive, and quickly identifying, quarantining, and testing close contacts of the identified cases. The recommendations and strategies also include postponing travel. These actions, along with wide availability and high uptake of safe and effective vaccines, will help us return to our everyday activities much sooner. And a final note, this is National Influenza Vaccination Week. I highly recommend that everyone get their flu shot to help avoid a twin-demic. We know what we need to do, so let's just do it. Let's mask up, wash up, back up, and sleeve up for our flu shot. Thank you.